and then she does everything. Now, I mentioned earlier when someone asked about fingering, there's something called bacterial vaginosis that a lot of people confuse with white, because in that one too, there's a whitish discharge. It may stick to the vaginal walls, it may get into your panties. What you realize is, after some time, after you've bathed and then you've been active for some time, it smells like rotten fish. Yes, once you are in a girl's school, I don't know how many of you are boarded here. Once you're in a girl's school and you share toilets, you hang your panties outside. There are a whole range of bacteria in the system. It is not strange. That if someone has that, it is not, the person shouldn't be stigmatized, because we can all have it. I've been to a girl's school before and it is there because you share toilets. So normally you advise that you disinfect your toilet seats before you use them, because if someone uses it, you can easily come and catch it. Now what that means is that I said that for the risk factors, I mentioned that it is a risk, it is a symptom. If you see it, it doesn't mean that you have cervical cancer. White or candidiasis presents like that. Bacterial vaginosis presents like that. It is one of the symptoms of cervical cancer. The best way you can find out is to go to the hospital. But I must say that at your age, it is highly unlikely that you have cervical cancer. It may just be bacterial vaginosis, which is a bacterial infection. Okay? And then what I would warn all of you about is that you just don't go about taking antibiotics because you think you have a bacterial infection. I mentioned earlier on that we have normal flora. They come in the form of bacteria. They are normal flora. We have some living on the skin, we have some living in the stomach, we have some living in our vagina. It protects us. That is why when you go to the hospital, when you travel outside, when you go to the hospital, they just don't give antibiotics. If it's a simple cough, they may give you a cough discharge, they may tell you to go and eat fruit. Because the more you take antibiotics, you kill bacteria, even good ones. You understand? Now what you are saying, if it is bacterial vaginosis or candidiasis, as I mentioned, if it is that, it means that conditions have changed. There are a lot of conditions that will cause abnormal bacteria, or opportunistic ones, as we call them, to overshadow the normal ones. It's just like we are here in school, and then some people come from outside to come and fight us. If conditions change, if you are not fed well, and then you all fall sick, they can easily come and take over. If you take antibiotics, you can kill all of them by your own. So if you have an infection like that, it's good you are eating fruits because you are boosting your immune system. You understand? But you go to the hospital, there are particular drugs they will give you. If it is white, sometimes, because it can be differentiated, whether it is white or bacterial vaginosis, you are given antifungal, antibacterial, antiviral, so that it will just be a broad spectrum and it will take care of everything. But I am very sure, I'm about 90% sure that you do not have cervical cancer. You have not gotten to that age. If anything is abnormal changes, you do not have cancer. It may just be any of them. You just get yourself treated, and then you disinfect your toilet seats, you iron your panties, and then you bath. You don't insert things there. Okay? It's very okay to wash your vagina with water. It's just like your throat. You don't clean your throat. You understand? It's the same kind of epithelium that is there. It's the same kind of skin. You don't clean your throat. You just brush your mouth. Your throat is taken care of. It's the same as your vagina. You don't need to insert soap, things there, herbs. No, you don't have to do that. If you do that, you harm yourself more. Okay? So if anybody is here who is experiencing what she just said, I know this is a girl's school. She's the one who said it, but a lot of people have it. Do not just insert anything there. Wash with water, disinfect your toilet, iron your panties, and wash your clothes, wash your panties, change your panties. It's as simple as that. It doesn't mean you have cervical cancer. No, you have to go to the hospital to check abnormalities. Is your question answered? Okay. So if anybody hasn't got a question, then I'll just entreat you that you just do very well to eat fruits, exercise more, drink more water, clean your surroundings, and then you watch yourself. When you go home, please, it's very important to me, don't go and have sex. You are not married, you don't have any business trying sex. You will hear a lot of stories about it. Please don't go and try it, because it can do you more harm right now than good. Even if you do not get any